Singh Indraprasth University is offering a MOOC course on healthcare infrastructure planning. It is being offered by SWAYAM under Ministry of Education. Guru Gobind Singh Indraprasth University has 5 medical institutions affiliated to it, along with 5 affiliated architecture colleges. Healthcare infrastructure planning is a multidisciplinary course. It is spread over 15 weeks with 40 modules. The course has 4 transferable credits. The course shall be assessed for 30% internal assessment, which shall be based on reports, quizzes and progressive marking. 70% of the coursework shall be assessed by National Testing Agency at the end of the course. This course is being offered to students passing out from school, graduating students from architecture, engineering, medicine and its allied fields. The objectives of the course are to provide world-class education through latest technology, to impart experience-based learning processes across organizations, internal operations, processes, techniques, services in different departments of healthcare infrastructure system. To develop analytical approach amongst multidisciplinary professionals including doctors, architects, engineers, hospital administrators, IT professionals, healthcare and safety professionals, quality managers, TPAs and professionals who are running the healthcare facilities. To strengthen the skill set of professionals across design, planning and management of the hospitals. To have an inclusive approach integrating stakeholders from planning, policy, design on a single platform.
Hospitals are challenging spaces. So your design of the space has to be taking care of needs from the embryo to the mortuary. Planning for the use intelligently. Planning for the understanding that human behavior depends on so many factors and to build in those factors for that behavior in your structure and your form, and the way your layout is done automatically without instructions, without reading labels and signs. That I think is the best way of. I saw this in my own hospital. One block was built, another block was built, completely different design, and we find that the old block was very good because the simple reason the end of the corridor in the new building had toilets, whereas end of the corridor in the old building had large windows with bright sunlight coming. Can you make your space bright and cheerful, not depressing?
Physical structure has lot of impact on our causation of disease, and at the same time, if we develop the structure in such a way which can help to build the health.
So as per the new education policy, it is possible for people to gain credits here, and the credits could be added to whatever courses they are doing in whichever university they are in. So Indraprasth University has given us this opportunity to train professionals who could understand what are the requirements of NAC accreditation in hospitals and how we could produce architects, engineers and building professionals to take up a role which traditionally was by the medical professionals for the medical professionals. The BIS standards which have been there for the last 40 years in Hospital Planning Sectional Committee have also to be revised. They have to be updated. The newer technologies, the IT support, all the newer modalities of treatments, of cure, the newer pandemics and whatever is required for that would be provided in a way that the knowledge base, the skills and the attitudes of the building professionals are made ready for people to go and help the society, and we make a healthy nation with healthy people having a very robust healthcare delivery system.
So students in the MOOC course will also learn about how to balance the physical infrastructure requirements of the building while also ensuring occupant comfort and ensuring that specific temperature and humidity levels are provided in specified laboratories, while ensuring regular and uninterrupted supply of electricity, water, and ensuring waste management.
So this course would quantify this gap using an integration of GIS and remote sensing.
The goal of any healthcare professional is to establish international standards in patient safety, infection control, and optimal workflows between the room and the department facilities and functional adjacencies.
This course shall enable participants to have an understanding of how to develop, implement and analyze a strategic plan for healthcare facility and appreciate the interdependency of various departments and functions. We welcome you all to this course.